Good morning from beautiful Brisbane, Australia, and welcome to Healing from Complex PTSD. My name's Linda. I'm your certified complex trauma professional, and I really love and appreciate all of you that have been here and making comments whilst I've been busy this year. Plus, we've just moved house, so it's been pretty full on. My question today would be, have you heard of genetic testing for your medication? And if you have, what's been your results? So I want to share a little bit about genetic testing for your medication, especially as I've been made aware in America, there are now TV advertisements saying if your medication doesn't work, here, use this as a booster. And when I heard this, I was like, my goodness, it's just not on, really. Big Pharma might not like me saying that, but it's a reality that we need to really look at. If your medication's not working, then we need other avenues so that you do get a medication that works for you. Now, genetic testing for medication has been around for a little while, not too long, like all of it at the moment, not too long, but it does have an 87% rate of effectiveness at this point in time. Now, to learn more about it, there is a blog post on genetics and medication, and you can gain it via the link in whatever platform you're on. My link will take you to the blog and you'll be able to see it. Now, why would we consider having genetic testing done for our medications? First of all, it actually does select medications that 87% will be right for you, okay? It can identify how your body processes and responds to various medications. It can give you the most effective medications whilst minimising the effects, the adverse effects, which in particularly it's useful for everyone with CPTSD because we can be really sensitive to certain medications as well and not know it. And it stops us going through the months and months and months of processes of waiting to see if something is going to work or not, okay? So it does reduce the trial and error process. And it also gives you the ability to have a medication that aligns with your genetic profile, okay? And that means fewer side effects as well. So they can tell you in the report that you get what's likely to help, what, will make sure that you don't get as many or, the least amount of adverse reactions instead of spending months sick and not knowing, should I persist with this or shouldn't I? Okay. Some medications actually have very serious side effects. So if they interact negatively with you, then it's going to make you very unwell. And when you've got to go to work, that's the last thing you want, is to be sick because of what a medication's doing, and then having or possibly having a doctor say to you, well, got to persist, got to stay on it a bit longer, and you know that it's not working for you. It can also give you an optimized dose because it does measure how quickly or how slowly you metabolize the medications as well. So it's valuable, but always make sure that you sit with a seasoned psychiatrist who knows about medications, who will know your story and will have a really good idea of what medications will work in your particular circumstances. Now, on the blog post, we've got a couple of women who had been in a situation where they tried so many, and it wasn't until they had genetic testing that they actually found out what would work for them. So if you've been in that situation, it's definitely something to check out. The blog post also has a couple of different places globally that you can go and actually talk to the people about it is it something for you? And I'm pretty sure in America, if you get a referral as well, it cuts right down on the cost. So, of course, different countries, and we're global here, have different things. So in Australia, we don't have ads that say if your medication's not working, best you take this booster. We don't have pharmacy or medication advertisements at all. Okay, so we're always going to the doctor to find out what will or won't work for us, or what do they think, and so on. So at least check it out for you. You can Google genetic testing for medications, and that should definitely bring up something in your area that you can go and look into. And some doctors aren't on board with it at all, okay? So one of my clients went to her doctor to get the referral to go to a genetic testing place, and he says, I'm not on board with that at all. Whereas genetic testing is actually providing so much information in today's world that it can't hurt to at least try to see if it's something that will work for you. One of my clients, Lisa, is happy for me to share what happened for her. She didn't want to be on medication at all. And because we had worked together for a significant amount of time, she was able to see that she had done all that she could recovery-wise and working with the neuroscience, getting well and being healthy in so many ways, that it wasn't until she had the genetic testing and it pinpointed exactly what would work for her, and it did work for her, that she was able to get on medication and begin to turn her life around even more so. So yes, recovery can help. And yes, when you're with a good coach, they should be able to let you know that it's not you, okay? It's actually that you need some medication in order to become more well, for your brain to, even get some stress relief. That's not an official medical diagnosis or anything at all. But when we've been through developmental trauma, it does cause incredible stress over quite a number of years, and it has to impact our body in some way, shape or form. So that's it for today. Let me know your comments, what you think of it, and it's okay just as long as we care for each other and, be able to acknowledge whether or not this scares the living daylights out of you, or it may actually be an answer to a prayer that you're able to go and get some help for you to help you become well and to help you function in a way in life that makes life a whole lot better. And it's not about making you feel happy. When we've got complex trauma, medications don't instantly make you feel happy. They actually help you be able to function. And I've spoken about it before as well. There is a neuroscientist, and they've got a video on YouTube, and they have identified one part of the brain that when they trigger it, it actually helps men. They did corporate men who had depression for a very long time and nothing had worked. And these men were fit, so they exercised well, they ate well. And when they found this part of the brain and zapped it, they experienced not being in a depressed state. Unfortunately, that will take time to reach the public sphere, and until then, we have nothing else but to use as many tools as we can to become well. Okay, have a great day, and I'll see you in the next video. Bye for now.